point. Do you know where this beat is originally from? You know the song where this beat is? Oh, okay. This is Biggie Smalls, but he sampled it from another like artist, R&B artist. I forget who it was, but it was a popular R&B album. So yeah, so cool. Dennis always plays it too long. So which camera am I looking at? This one, okay. All right, cool. So, hey, all right, cool. I guess I'm not looking at the camera, looking at you. We got a new setup today in the podcast. So we got Dr. Jeffery Katzell with us. He's an amazing orthopedic surgeon in Lake Worth. People in Hollywood are trying to make him go to Hollywood, but he said he's not Hollywood enough for Hollywood, Florida.
That's for sure.
He wants to stay in Lake Worth. But, Doc, so I met you probably like 8 or 9 years ago, I want to say. We met... was doing PIP suits for your office. Still are. And then we started doing like 300 depositions for a year together every Tuesday and Thursday or something like that.
We even did some on Saturdays.
Did we come in on a Saturday one day? I remember.
Yes.
Yeah.
Yes.
These county court judges are not the best. We had filed like, I think 400 State Farm lawsuits because they were underpaying every doctor for their exam codes in Florida, and they didn't want to pay. And then they did a global, thank God. Yeah, they didn't want to pay. So I did like 1 million depositions with you. And there was that one, I don't remember her name, but I remember it rhymed with blockhead. It was something that rhymed with the word block. And behind her back, I called her blockhead. But I don't remember her name anymore. It's irrelevant at this point. So Doc, tell us, you do surgery in Lake Worth.
That's correct.
You do spine, knees, shoulders.
Spine and extremity, yes.
Okay. And you've done a bunch of surgeries for clients that I represent in auto accidents.
Yes.
Phenomenal results. That's why we love you and we have you here today, because you do great work.
Thank you.
Trying to think here. Background. So tell us, where did you grow up? Where are you from originally?
From New York.
New York.
I am fortunate enough to be done with that virus, so I identify as a Floridian.
Yeah, nice. No more. I was going to say, you're not one of those New York liberals who came down here to enjoy the sun and then got COVID, did you?
Oh no, I am not I'm not a New York liberal, and no, this is really my home. I actually have very little desire even to go back to New York to visit.
Too cold. I got my license in Michigan to practice law. I went up there for 6 months. And then right before Halloween, it started snowing. And I was like, I'm not built for snow. I was born in Florida, raised in Florida. I'm never going anywhere.
Looks like you've done a good enough job here. I think that was a good choice.
It was a good choice. It was a good choice. The people of Michigan they're like, you're Cuban, Egyptian. Are those two places in Mexico where like they didn't understand? I'm like, okay, all right. Okay, well, I'm happy here.
Yeah.
So New York, what part of New York? Everybody goes by the 5 boroughs. We're the 6th borough, Boca Raton.
Yeah, right. Well, where I grew up, you wouldn't really want to be. I grew up in the South Bronx.
Boogie down Bronx.
Yeah, it's not truly a great place to be from. And then we moved to Long Island, obviously, like many people do that are ultimately here. But really, I mean, since 1987, I've been in Florida, and this truly is home.
Cool. Well, we love having you. So don't go back. Trying to think. And we did so many depositions together. I thought I'd remember what colleges you went to. Which college did you go to?
Well, Syracuse University for undergraduate.
Okay.
New York Medical College, and then University of Medicine of New Jersey for orthopedics.
Okay, gotcha. Okay. How did you get into auto accidents? Because I know you treat a lot of auto accident clients. How did you get into treating auto accident clients?
So orthopedics is really a trauma specialty. When you think about it, until you get hurt, until you're broken, until you need an orthopedic surgeon, nobody has a family doc that's an orthopedic surgeon. Mm-hmm. And it turns out that the people that are sometimes the most catastrophically injured are the people that have the least access to getting health care when they're broken. Mm-hmm. And if your job is to be a healer, if your job is to make people better that need to be better, they have to have representation. They have to have a go-to place. They have to have a doctor that they know will take care of them, even though there's a lot of challenges, of course, with reimbursement and getting authorizations to do things. And sometimes people really suffer and are desperate looking for help. Mm-hmm. And I thought that was a niche that I wanted to fill.
Mm-hmm. Okay. I know it's interesting because a lot of doctors, orthopedics, don't want to treat auto accident clients because of the depositions, the litigation. My favorite reason is, I've got some snotty second-year attorney telling me how to practice medicine and questioning my medical judgment when they don't even know anything about medicine.
The world would be so far better a place if professionals exhibited decorum and courtesy. We understand. I think that's somewhat of a defense mechanism. It seems that sometimes the less knowledgeable somebody is with their craft, the more aggressive they tend to be. Mm-hmm. I believe that the best of the attorneys on both sides are reasonable, courteous, and understanding. Mm-hmm. And basically, what is your remedy if you're hurt? What happens to somebody if they can no longer work, if they have constant pain, if they look forward to a lifetime of needing medications or repeat surgeries and everything else? Mm-hmm. What is your remedy? Who's going to take care of that? We need to have some assurance that there is fairness for injured people, as there be fairness for the people that have to be responsible for the covering of the costs of those things. So I like to think of myself as a voice of reason. I like to think of myself as somebody who is very, very thorough and detailed in terms of making an appropriate diagnosis and making sure that the treatments that we render in my practice always are the best thing for my patient and are the most indicated. If things are done in that manner, things just have a way of working out. Mm-hmm. I've never really been fearful about, we're doing something that there's a deferred agreement towards my staff getting paid or me getting paid. I never worry about that stuff. I just say, if I do the best job with my patients that I possibly can, if everything that we do is with honesty and integrity, it's all worked out okay. I've done okay.
Yeah.
That's what you want to accomplish.
Yeah, definitely. The level of skill that you have, because I've seen it firsthand with the clients that I represent who've had a procedure done by you, the level of skill is unquestionable. And the fact that you're willing to treat people when other doctors say, no, I'd rather treat them with health insurance, Medicare. If they don't have it, too bad. Because people can't afford to get a neck surgery without some type of, health. Like a lot of my clients don't have health insurance. So what are they supposed to do? Live a lifetime of pain
and suffering? No, that's exactly why we choose to do that, to take care of our patients. Mm-hmm. Obviously, of course, the easiest thing is to let an insurance company always be responsible for everything. But the reality of it is life doesn't work that way. And a lot of what we do in our practice encompasses using expensive implants. Sometimes it's so difficult to get these things covered. You can always get an iliac crest hunk of bone from somebody's pelvis that you could use to fuse a spine. I would never let that happen for me or anyone I cared about. I would never let that happen for my patients. If I think motion preservation is the best thing for somebody, as opposed to a fusion in the neck, and we're doing a disc replacement, and just the hardware alone is $6,500, and how many times do you need multiple levels done? People need to have a way to get their life back. Mm-hmm. They don't recover if you don't do the best job with the best instrumentation that we have out there.
Yeah, and so it's funny you mentioned that, because I've seen you operate in the operating room. I've seen you perform surgeries on people. I've seen you do ACDFs, knee surgeries. I don't think I saw someone else do a shoulder surgery. It wasn't as good as something you would have done, I'm sure. But that being said, I do remember, I hope it's not offensive to anyone on here, but you said there was a tendon from a cadaver. And do you remember what you told me? You said this guy's job in life. Some people were born in life to accomplish great things, and this guy's job in life was to have the perfect
cadaver tendon.
Cadaver tendon.
It was thick, strong. It had beautiful hard bone at each end. That was just for an ACL reconstruction. But, you know,
I remember that client you did it on too. That was a great client I had. I remember him, Jimmy. He's a nice guy. But that was hilarious to me because it was watching you perform that surgery was like watching a carpenter. I didn't realize this, and most people won't realize this. Like knee surgery and probably spine surgery too is just advanced level of construction, right? Reconstruction. I mean,
there is a certain, when I was first in training,
thinking about that cadaver.
One of our attendings said, surgeons are born, not made. Yes, it's advanced carpentry, but the outcomes, especially with our spine surgery, are so dependent. The gentleness of your touch, the gentleness of your fingers. I don't have blood products in my operating room. I don't. We never lose blood. I don't let people lose a teaspoon of blood. It's just. Yes, there are power tools that we use, of course.
I saw you in there with a screwdriver screwing that tendon into the bone.
Yeah.
I saw that. I said, "Oh, my
bioabsorbable fixation." Yeah. That's part of it. To be honest, my personal preference, I like spine surgery. I mean, of course, I do knees and shoulders, and I believe we do them well. But my favorite thing for me to do is spine surgery because it's the most delicate and it's the most gentle. And I think it is the absolute most life-enhancing thing that a suffering person can do. So, I mean, of course, we take care of people that need to be taken care of.
Right.
And we give it 110%. But I wish everything that I could see would be to take away a crippled person's pain when we fix their spine. I think that's probably the most satisfying thing that I can do.
That's what brings you passion in this job, and why you're doing it so long is you love what you do.
Yeah, and I am an old guy, that's for sure.
Well, you said 1987, and I was like, I don't want to say it, but I was born in '84.
Yeah, I know. I mean, I know. I'm asked that all the time. I know. I am old. Yes,
it's okay. That's
I'm old,
wise.
But I enjoy it.
Wise like the old owl. And so okay. Talking about spine surgery, what are some rewarding cases that you come to top of mind for you? If you could just give us some examples about what you see as the end result when you after you perform your spine surgery on somebody.
I have to do that with names redacted.
A lot of them are insurance defense lawyers that come see you, which you can't shout out their names right now.
Especially with names redacted. Then. But I can tell you one, and I can even tell you this because it was so satisfying. And this was just something that we did actually because I saw her 2 days ago. So that was 5 weeks and 2 days post-op. It was a very interesting case because it was a challenge. A delightful lady that had actually first a very bad accident with 3-level disc pathology in her neck with really, really bad spinal cord compression. And, amongst the things that you always have to say when you're educating a patient, if you leave spinal cord compression, and you're always, tortured about this, when you're in a deposition, they say, well, they didn't really get paralyzed, didn't get that yet. But you still have to say that because that can really happen. Now, I did not start out with that patient seeing me. She had another orthopedic group. And they were vacillating back and forth. She had a zillion injections, months of therapy, and were vacillating. Well, it's so big.
What's vacillating? You're scaring the hell out of me with these big words.
I'm sorry. They were. The doctors were contemplating. Well, how can we fix this? It's so many levels. It's 3 levels. There's 3 levels of cord compression. Do we just do C3-4 because, or what? Do we have to send it to a center? Do we have to go from the front? Do we have to go from the back? There's so many things that we all think about. You have pressure on your cord and you don't relieve it. What good can happen, right? So then she has a second minor accident, not necessarily quite the impact of the first, but there was an extrusion at the C4 level, the middle of her 3 levels of injury, And she developed such rapid neurologic deterioration that she was in a wheelchair. She went from 3 jobs to not using her arms and legs and was in a wheelchair for several months.
She worked 3 jobs, car accidents.
Then
now she's in a wheelchair.
Then she could not take care of herself.
What are some symptoms, just for the viewers, of spinal cord? Having a brain fart right now.
So spinal cord compression. Yeah. She developed myelopathy. So she started out with just severe stiff neck, and she was getting some numbness and weakness and fatigue in her arms, and it kept getting worse. Then she had more exacerbation of pain, this terrible deep burning, and then it can sometimes be subtle. She would say, "My arms feel so heavy," and she'd find herself clumsy with her hands and dropping things, unable to do just normal activities of life. But at that point, it was all still upper extremity work. Then after the second accident, she couldn't sign a consent for surgery. She had such profound weakness. And if you have really good spinal cord compression, it actually affects not just your arms, but your lower extremities as well. So she couldn't walk. So we got a new MR. It showed myelomalacia, huge compression on the cord at C4-5. Myelomalacia means there's such compression of the spinal cord itself that it ceases to function. It doesn't even have its blood supply. The signal, the color alteration on an MR even changes, and the compression of the cord goes from something like round to something like V-shaped. And by the time she came to me, I had to tell her that I was really, really concerned that we may not be able to get neurologic recovery from this. But she was desperate and pleading and asked us to try, with the understanding that this is really serious. Why? The C3-4 disc innervates the phrenic nerve. The phrenic nerve
you got to explain that to me.
The phrenic nerve innervates your diaphragm.
Okay.
So if you have cord injury at C3-4, that doesn't just make you a quadriplegic, where you lose the use of all 4 extremities. You become a pentaplegic, where you also can't breathe on your own.
Okay.
So you're on a ventilator forever, i.e. Christopher Reeve, Superman.
Wow.
So, you have to tell somebody with this thing, you have such cord compression, there's frank cord damage. And to do this, to fix this at this late stage, couldn't even be life-threatening. And that's not hyperbole. That's what you're really thinking about when you go into the operating room with a case that's this complex. So we did this thing, and you have to do this because you're basically peeling, now adherent disc material from an extrusion on the cord. And you have to be so delicate. So you're using a 1 millimeter kerosene. It's an instrument to bite this thing off. Remember, there are 25, scissors. Well, this is sort of like a scissor, but sort of. But remember, there are 25.4 millimeters in an inch. So you're sitting there taking out things that are the size of your thumb, sticking in a cord with a 1 millimeter instrument. You're sitting there looking in your operating microscope, twisted like a pretzel, for 5.5 hours to do that. It's not that easy to do.
Yeah.
It is a stressful procedure. It's a stressful job. But the amazing thing, and I'm sorry to take so much time, but this was important to me. The amazing thing about that, in the recovery room, she was saying, it was still weak, but she said, "Doctor, look, I can feel my hands. They're moving a little bit." And that was even great. But why did I bring this up? Why was it so forefront in my mind? So 5 weeks and 2 days ago, she had her follow-up in the office. And, of course, she's still doing, her wheelchair. But she said, "I want to show you something." She got up from her wheelchair, and she didn't walk a mile, obviously. It's really her first time walking without, we got up on her own and walked from my exam room to the x-ray room, and she was able to do it.
Wow.
That's why you do this stuff. That's why if there's anything that I have an opportunity to do in my practice, I will tell you I want to do that for as long as I possibly can.
That's amazing. And so you treated this woman. She was in an auto accident. You did a surgery on her neck.
3 levels, C3, 4, 4, 5, 5, 6 discectomy fusion.
Wow. Okay. And she's still in a wheelchair, but she's extremely. She's getting back the grip in her
Her upper
grip.
extremities are basically normal now.
Okay.
Her lower extremities are much improved. She still uses the wheelchair for long distance, but she could not lift her leg up or do personal hygiene or or
It's hard.
Yeah, or even put on footwear before, and now she can just lift her leg, lift her arms, do her hair, all the things that she, and that
She's
was
getting
really,
back to normal.
Yeah,
that's amazing.
Yeah, and in a few months, I'm cautiously optimistic that we're going to get her back.
You think is she going to need a lumbar surgery in her low back, a low back surgery to help her get back to walking? You think, or is that you're going to see how it goes with the
cervical spondylitic myelopathy is cervical cord compression, damage to the spinal cord. What many lay people cannot understand is that damage to the spinal cord affects upper and lower extremities when it's really profound. So she was actually seeing several other doctors before that were trying to understand why her arms were, of course, horrible. Why was she getting the leg deterioration? She's not going to need lumbar surgery.
Oh, wow.
Her problem is from her neck.
From the neck, okay.
And she is going to get certainly significant improvement. I can't tell you 100%, but she's going to get a lot of improvement.
Yeah, you do amazing things because I know we had another client who was at your office, had a lumbar surgery, and I want to say it was like a week. You probably know better than me. It was like a week after her surgery or 2 weeks after her surgery. I think it was maybe a couple days after her surgery. She was dancing. Oh, Colombian women love to dance.
His name's redacted. I know exactly that patient. Yeah.
She was like dancing. She's from Cali, where they love to dance salsa, and Cali, Colombia, and they love to dance. And then you said, "How you doing?" And she started dancing in your office. It was crazy.
She was an amazingly skilled dancer. Yeah. That's what happens when you really decompress spinal pathology. It's patients love it. My little lady from 2 days ago had her daughters come in. We were all crying together. Because there was, it's just, I mean, that's why you do what we do. There's stress in it. They're the naysayers. They're the people that always try to take their shots. It's their job.
Right.
But you know what? I don't care. This is what keeps us going if you do what we do.
Yeah. I could see the insurance company hiring a doctor. Say, oh, she's fine. She's in a wheelchair on her own accord. These guys are horrible that they hire, these defense doctors.
This is something that I wish could perhaps eventually be changed in law. So if you're the insurance company doctor, you do not have a doctor-patient relationship. So that gives you impunity. That gives you an ability to say things.
To lie.
That stretch the truth, because there's no adverse ramification. So if this lady is seen by somebody that's hired just for one purpose, to help to defend litigation, and they say they should never get an operation, and they end up permanently in the wheelchair, the person that's not the doctor-patient relationship person does not have any exposure. But if I, as the treating physician, don't diagnose properly, don't treat properly, and don't perform surgery properly, where does that put me? It's a different level of care and caring and concern. And I will tell you, it's a heck of a lot easier to work on the other side, and it's a heck of a lot more lucrative as well.
Yeah, they get paid a lot of money to say crazy things, lies a lot of times.
Sometimes they do say things that would be absolutely disparate to the best interest of the patient. And that's a shame. But it's like everything else. There are good, there are bad. And there are some that will say, yes, this person's injured and they need your help. And to be honest, I do work for the insurance companies also. And usually they're with, at the request of attorneys that are very, I think, good people. And very often they'll call and say, when they're trying to have me evaluate somebody, they'll say, I think this person is really hurt and possibly in trouble. Can you tell me what you find? And of course we do that as well.
So about that, there's, so certain defense lawyers, insurance company lawyers will hire you and say, hey, can you give us an honest opinion? And then I'm obviously talking about the people that don't give an opinion that's honest at all. They're hired to purposely reduce the value of a settlement, exposure to the insurance company because they want to save money. I had a case where we had a client. This was for a PIP suit that I was doing. I was representing an orthopedic group who had a patient who needed a surgery, and the guy had $100,000 in medical payments coverage. So they would pay up to $100,000 for his medical bills. And so the guy ended up not getting the surgery because his insurance company hired a doctor that told him, you don't need surgery, you're fine. And the guy ended up believing his insurance company over his own treating doctor. But what's interesting about that case is they had him drive over an hour and a half to see their doctor for their exam, an hour and a half. And in the PIP suit litigation, my question was, why do you think they had the patient drive to you for an hour and a half? And and he said, oh, because I'm the best. But then he was asked, well, when's the last time you actually performed surgery? And it was over 10 years ago. And it's like, so they sent you, and he still called himself a surgeon, but it was over 10 years ago. And it was a very interesting deposition, but they ended up paying on that claim. But they paid, I want to say they paid him, it's been a while, I want to say like $1,500 to $2,500, something like that, to meet with the guy. The patient said, I think it was like a 15-minute meeting, something like that. It was crazy. But that was a couple years ago. But I did the math. There's literally thousands of medical doctors in the distance between where the patient lived and where that doctor had his practice. And I said, come on, man, what is this? This is the most bizarre thing I've ever seen.
That is a very, really clever point that you bring up. It's interesting because I have had other doctors, we teach spine surgery and we've had to do it across the country and across the world. I've had other doctors from other countries fly their family members to us in Little Lake Worth, nowhere, for us to do surgeries. I understand if you have somebody that you've been exposed to that has seen the results of a surgery, and people will travel that far. But really, if when you're giving, that's not patient care. When you're giving expert testimony, you should not have to travel that far because people should, if the system works properly, be honest when they're giving expert testimony. Many people are, but like all systems, too many are not. And typically, when they're really the bad ones, they'll just make people go a long, long way to get a specific outcome that is expected by the party that's hiring them. That should not be.
Right.
I think that's a weakness in the system. I think both sides need to be fair, but many times it just falls below what you would expect it to be.
Yeah, where are some of the places that you've lectured at? I know you've lectured all over the world. I know some of them, but
I had to go to China twice. I'm not about to go back there anytime soon. I've had to go to Korea, which actually has amazing, amazing hospitals. The word hospital.
South Korea, you got to say though.
Well, they as I said, South Korea, they build hospitals. North Korea, nuclear missiles. I understand that. That's true. But amazing doctors there, an amazing spine hospital in Wardle and Seoul. I mean, we had to go to, obviously, Latin America, South America, but also, more often than not, it's right in the States.
I remember you went to Turkey once
Yeah,
for lectures, Mexico.
Yeah, a million times. Yeah, it's hard because when you do that, you know, the staff I have in the OR, and I have no ownership interest, but the staff I built with the OR and the building that we built that I, again, have no ownership interest in anymore, are so good. But when you go to these other places, you know, they take their most difficult cases for you to operate on. Mm-hmm. And I have to tell you, the equipment, we're so blessed to live in our country. Mm-hmm. You just have to go into a hospital and see what people deal with when you're trying to make broken people better in other countries. Mm-hmm. And you just want to, you know, after you clear customs, you want to just get on your knees and like kiss the dirt to thank America for letting us be there. Yeah. Too often, you know, there's too much, I guess, criticism on American healthcare. And I have to tell you what, you know, we were teaching in London about a fusion implant that we were involved with. And these were wonderfully skilled doctors, you know, the Royal College of Surgeons. They were really, really, and they were so anxious to do this implant. We were, you know, training them how to do it. And then they said, well, what are the reimbursements? It's not for the doctor, it's for the company that builds that stuff. Mm-hmm. And they said, oh, we could never afford these things in the UK. Mm-hmm. You know, and that's a shame. Yeah. But we do have those things.
Yeah. I own the 2 MRI centers, one in Boca, one in Fort Myers. We have people from Canada. Obviously, Boca Raton has a lot of Canadians. You have people from Canada coming down. They'd rather pay cash for an MRI because they have to wait a year. They have free healthcare in Canada, but they got to wait a year. Right. And I wasn't treating a guy. I'm sorry. I was representing a guy who was in a car accident. He had a brain injury. Oh. And I said, well, come to my MRI center, because he was told he had to wait 1 year to get an MRI in Canada, even though they diagnosed him with a brain injury at that particular doctor's office. They said, yeah, you definitely have a brain injury, but you're going to take 1 year to get you an MRI. There's no life or death situation, so you're going to have to wait. And he was my client, and I said, well, I own this 3T MRI, which is a state-of-the-art MRI machine. I said, why don't you come down and do it here? So he literally was cheaper and safer for him to just get on a plane, come here, do the MRI, go back home. Obviously, he had a prescription for an MRI, sure. But it was just amazing that he had to wait a year for a brain injury.
Amazing the differences.
Yeah.
You know, and when we lectured in Switzerland the first time, one of those, I think it was our first time there. So you go into a hospital. It was just really remarkable. And you walk in, and it looks like you were in a nicer hotel probably than I've ever been in. They had a 9-foot concert grand piano with a pianist in like those tuxedos with the long tails at the bottom.
Oh, nice.
Playing, and there's a champagne caviar bar in the lobby. And I said to Dr. Lau, the doctor I was teaching with, I said, is this what the hospitals in Switzerland look like? And he just laughed. He said, no, that's the private hospitals. Oh. He doesn't work for their universal health care. Mm-hmm. I wish that there was parity, that healthcare was healthcare everywhere.
Yeah, and it's unfortunate.
But in Canada, great doctors, but you wait.
Yeah, it's sad. So a lot of people don't know, but you are a phenomenal artist. I've seen your paintings, don't lie. You did like a Rembrandt thing in your office and a sketch.
I'm trying to learn how to paint. So it's not the easiest thing.
Have you seen my paintings? It looks like finger paint compared to what you have. Are you kidding me?
Well, I read books on, because I'm old, I read books from the old masters, painting techniques. Okay. And then when I travel and I see something that I that I really love. You know, I mean, I went to the Reich Museum in Amsterdam, and I saw Rembrandt's Night Watch, and I said, my God, how did anyone ever, you know, become that gifted at anything?
Mm-hmm.
Amazing. So that took me a year and a half to do that painting,
Wow.
by the way.
Wow.
You know, because I use like usually a number 4 brush, and it's done with oils, layer upon layer upon layer with glazing. But it's
Wow.
it's
There's probably a YouTube video out there somewhere now on how to do it in like 30 minutes, probably.
yeah, probably, but I'm not that smart a guy, you know, and I hate computers.
Yeah.
You know,
Well, you're a really good surgeon, I'll tell you that. And
I try.
you're a very, very good surgeon. All right. Also, not a lot of people know you play guitar.
You know what? I am studying. I'm trying to teach myself how to play guitar. It's a long effort. I was actually a trumpet player as a kid.
Oh, wow.
I mean, like a good one. Like I mean, like.
In the Bronx?
No, that was in Long Island.
Oh, okay.
Yeah,
I was going to say, you probably get your ass beat in the Bronx over that.
In the Bronx, they would steal your trumpet, you know. But
And this isn't Yonkers, right? I had a girl that worked for me who goes, yeah, I'm from the Bronx, Boogie Down Bronx. And then I said, I heard you're from the Yonkers. And she got really pissed.
Really not the Bronx. Where I grew up is not the Bronx.
Stephanie, if you're watching this, everybody's now knows you're from the Yonkers.
But you know what? When we did not come from a family of privilege at all. Mm-hmm. And when I got accepted to medical school, you had to have a microscope to be able to go. And my parents could not buy a microscope.
Wow.
And actually my high school band teacher gave me a trumpet. It was a really, really, you know, very nice trumpet that people helped me get. It was, you know, believe me, I would not have been able to have it. You know, I was lucky. I had a dear friend who had a music store, and between that and somehow I ended up with a trumpet. Don't ask me how, because I certainly, but I sold that, and I got enough money for it to actually buy a microscope, and that's
wow.
So I've never.
What a story!
I've never touched I've never touched a trumpet again.
Wow.
I would not know how to play it anymore. I'm sure. Well, probably not.
Can you play the guitar for us today? Dennis, we got a guitar here. Let's rock and roll. But that's an amazing story. I mean, only in America can you grow up in, you said South Bronx?
Yeah.
And then now you're a world-class surgeon. So that's what I love about America.
I love America. I don't know about world-class, but I just know I try to.
You told me you were all over the world. What are you talking about? Of course it's world-class. Well, don't downplay it.
But let's just say, I believe if you have a passion and work harder than everybody else, because certainly I'm not smarter than anybody else, but I believe if you have a passion and you try harder than everybody and you want it badly enough, I think America gives you the opportunities. I would still be digging swimming pools if I didn't have scholarships for school.
Wow.
You know, I mean, there was no way I was going. I mean, my family made it very clear from the time I was a kid, you know, if you want to get an education, you better work for it and get scholarships. So that's what we did, and
Awesome.
it's all worked out okay.
Awesome. Well, thanks for coming on the podcast. Appreciate you.
Thank you.
Thanks, Doc.
Thanks for everything you do.
Thank you. Thanks. All right, cool. We're good. You got a friend?